Hi everyone, this is Lahir from ABCs of Anesthesia, and today I'm going to go through a bit of a novel technique for blood collection. Now obviously cannulation is something that I do time and time again, and often if I need to take blood, I'll still insert a cannula and I'll take blood with that, because I find that a cannula is just a plastic device that's inside the vein. There's no risk once the cannula is in, there's no risk of a needle rupturing inside of the vessel, especially if it's a very difficult cannulation or very small vein. Now my novel technique is really just to do that cannula but backwards. Now I want to stress that this is a really advanced technique, so it's something that I don't see many people doing, but it makes a lot of logical sense. If you want to attempt this, please do it under supervision and only with the consent of the patient and your supervisor. This is a bit of a novel technique. The reason I came up with this technique is because a lot of the time I get called to do bloods when it's most difficult, and this is often the only option I have for taking blood. Now I want to go through that in a bit more detail. So imagine a vein on my patient's hand. Right now, blood is flowing in this direction. Normally what we do is we insert a needle in this direction. What that does, that needle ends up blocking most of the flow of the vein. And so it's going to be very hard to take a good quantity of blood because the flow has been decreased. Now what I'm suggesting that we do is, because blood's flowing in this direction, why don't we insert a cannula or needle backwards? That way, all of that blood, all of that venous return goes straight into the cannula without any obstruction at all. So what I'll start with is a lot of the same things. I'll put a tourniquet on just to try and improve my vein selection. And as you can see, I'm getting my position very different to a normal cannula because of the trajectory. Because I'm going backwards, I'm trying to find a vein and I've got a nice, good action across, my body that's, feels very normal. Again, there's an advanced technique, so make sure you're really comfortable with cannulas and appropriately supervised for this. So I've chosen this vein across here, so I'm just going to swab with alcohol chlorhexidine, ensuring the patient has no allergies to this. All I need to use is a small gauge cannula for this, so a 22 gauge is absolutely fine. And my technique is slightly different. My tension on the skin will be going distally this time. Again, low angle of insertion. Getting the flashback, leveling out, advance a few millimeters. And already I can see that there's going to be a good flow of blood back. So what I do then is I can go straight on with the syringe or place an IV bung on here, just like that. And this probably makes a lot of sense now. What I have is I have blood flow back from distal to proximal, and so my cannula is taking all of that blood very easily. And you'll notice now, sometimes you get enough pressure that you don't even need to aspirate on the syringe, but in this circumstance I do. But that's aspirating blood at a rapid rate, as if I was actually taking it from a large cubital fossa vein. So that's fantastic. So I won't take too much of my friend's blood here, and then I can always flush. Now, if for any reason you need to sample some blood more frequently, you can always keep this in for the appropriate amount of time, ensuring again that all your protocols are followed from your local hospital. So that's a novel blood taking technique with a cannula, the reverse cannula technique. And again, I find it so useful, especially for those tricky patients with very tiny veins where I need absolutely everything to go right for me to collect blood. Thanks a lot.